We're here with Dr. Fargo today, and welcome.
Thank you.
We'd like to find out, how can chiropractic help with headaches?
It's a great question. Headaches are oftentimes caused by irritation that's being created in the upper neck, especially when the head isn't really sitting properly or you're misaligned where the head joins the neck bones or the vertebrae. What will occur is that you'll actually get irritation of nerves. Those nerves come up over the head here, and just like any other nerve that gets irritated, it can cause, in this case, headache pain. So if you can identify exactly where that source of irritation is, realign the neck or the way the head is sitting on top of the neck, a lot of times headache pain disappears. It's sometimes miraculous and quick and easy.
And what about the different types of headaches? We hear a lot of people, I have stress headaches or tension headaches or migraine headaches. Which ones tend to respond the best to chiropractic?
Well, actually all of the ones that you mentioned respond really well to chiropractic care. Migraine headaches oftentimes, and I will tell you too that many of these types of headaches have other triggers. So far we've just talked about the physical things, physical irritation, inflammation, nerve irritation that's coming up into the head. But there can be nutritional issues, for example. There can be toxicity. Those things are also really easily identified and handled. We talked about that in a previous interview that I did about food allergies and how that impacts things like headaches.
So if someone comes into your clinic, describe the initial evaluation process. What do you check for? How long does it take? And what can people expect if they come in for this?
Okay. So the initial evaluation that we do takes between an hour to an hour and a half. Many people who have an evaluation here will comment afterwards that this is the most thorough exam that they've ever had. And I'm not just saying that, it just happens to be the case. What we do with you is when you come in, we don't view you as a headache or a back pain or a neck pain. We view you as a person. And our job is to identify what are the things that are actually creating irritation, a loss of health and vitality for you as a whole person. So we do a very thorough intake history with you. You fill out a questionnaire first, whether you do it in the office or you download it and do it at home and bring it in with you. That's very thorough in itself. Secondly, we do an interview with you. We go over and discuss your major health concerns, your major health complaints. Then we will do such things as evaluate your ranges of motion in your spine, checking to make sure all of the different parts move the way they're supposed to. We'll take each segment of your spine and feel for the movement between each segment. We do a full postural evaluation. We test every major muscle group in your body. If you also come in and you have a foot problem, a knee problem, an ankle, a hip, elbow, wrist, shoulder problem, we fully evaluate those. We do a range of tests known as orthopedic tests, which basically look for joint damage. We evaluate your nervous system. We listen to your heart. We do your blood pressure. And if needed, we'll take x-rays of whatever particular part of the body we feel is in need of assessment. And that pretty much encompasses the exam that we do. And like I said, it takes at least an hour just to do that.
All right, that's very helpful. Well, thank you for sharing, and we appreciate the information.
My pleasure.